Good morning. I want to thank everybody for coming. When I had a meeting this morning with my staff, one of the things that we all agreed on was that we never have customers that walk into our customer service centers and say that they want free water. That's not what they say. They say they're having problems paying the bills. Affordability is an issue. And even when you designed the best assistance programs or affordability programs in America, they're going to be customers that fall through the cracks. And I can't tell you how rewarding it is to be able to work for a mayor that I can call, that I can use the clout of his office to be able to improve on the plans that we have already in place and that you've heard me talk about on so many occasions. So there are a lot of people to thank. I certainly want to thank Governor Whitmer for her assistance in creating this plan. I want to thank my board of directors, and we have Jonathan Kinlott, who was on the board of directors of the Detroit Water and Sewer System. I need to thank him. We have the city council represented by Roy McAllister. You'll hear from him shortly. But most of all, I want to thank the mayor for pushing us to be better, to create better plans, and to create plans that take care of those customers who have fallen through the cracks. Mayor Mike Duggan.
All right. Well, good afternoon. In recent weeks, the city and the state have been intensely coordinating our response to what we believe is the inevitable spread of the coronavirus in the state of Michigan. We're fortunate in the fact that our former health director, Dr. Jonay Khaldun, is now the state's director, and she and Denise Fair, our current city health director, have been working together. But the governor and I have been talking the last couple weeks, given the importance of hand washing in preventing the spread of this virus, to deal with the question of what happens with water shutoffs. And the governor and I sat down and said, we're going to have a solution that no resident of the city of Detroit has their water shut off for lack of funds. Now, we know that Gary Brown and the Detroit Water and Sewer Department have done an outstanding job with the RAP program. More than 16,000 Detroiters today have their water on because they came in, they asked for assistance, they were low-income residents, and they've got the help. Pretty much everybody who comes forward to DWSD gets assistance to keep the water turned on. On the opposite end, we know that a moratorium on shutoffs is a guaranteed failed policy. Any place moratoriums on shutoffs have been implemented, huge numbers of people who could pay stop paying because there's no consequence. And that means everybody else in the city ends up with huge rate increases. And so we sat down and said, how can we deal with this? And what Gary Brown said to me is, what I really need is an additional source of funds to build a new assistance program. And so with the support of Governor Whitmer and County Executive Evans at the last Great Lakes Water Authority meeting, GLEWA transferred $1.1 million in additional assistance to the city of Detroit. They also transferred $500,000 to Flint. In 1 week, Gary Brown and his team put together the proposal and the plan that you're seeing today, and it will go into effect this Wednesday. And basically what it says is that if you receive a shutoff notice, it's come in the mail or it's hung on your door, you can avoid your water shutoff by paying $25. And we will keep your rates at $25 a month as long as COVID-19 remains a health threat in this community, which will certainly be a period of several months. So if you get a water shutoff notice in the mail or on your door, you contact us and you'll be in a $25 plan to keep the water on. If your water is off, contact us, and for $25 it'll be turned back on. We think we put this in a position where everybody should be able to afford it. But Governor Whitmer said, I don't want there to be any question. And so the state of Michigan has said for the next 30 days, the state will pay the $25. If you'll come in and get on the program, the initial $25 will be paid by the state to get you started. So there is no financial reason anybody in the city of Detroit should have their water shut off. And so starting Wednesday, if you call 313-386-9727, and I know the media will display this, we will have an immediate enrollment process. And I feel very good about the fact that this is what happens when the state and the city and the county executive work together. I know Jonathan Kinlock, who's representative of the governor's office, is here. The governor wanted to be here herself, but she's got a couple of other things that she's doing today, but I know you won't have any trouble finding her. But she and I talked this through at length yesterday to finalize the details, and she's just been a tremendous partner. So as of Wednesday, the only residents of Detroit who should not have water on are those who don't reach out. It won't be for a lack of money. Call that number. We will be there to help you, and we'll get your water back on. And to explain the details of this, a guy who's just done an outstanding job with the RAP program and now with this new COVID-19 assistance program, I'll give it back to Gary Brown.
Thank you, Mr. Mayor, and he's done a great job of explaining the bones of the project, of the new plan. Let me just say that between 92 and 94% of Detroit residential customers are paying their bills on time. So I want to dispel this myth that everybody in the city of Detroit is having a problem. And let me also say that even though a lot of our seniors may be below the poverty line, they're making their payments, 92 to 94%. So we're dealing with about 6 to 8% of the residential base. We know that there are approximately 3,000 households that have had their water shut off, and they fall into one of three buckets. One, the water was shut off and they moved. Sometimes they move back home, they move in with a friend or relative, they find somewhere else to live and the house is vacant. Sometimes we know that we can see in our system that the water's back on and we didn't turn it on. So we know that they turned it on. And then sometimes they're living in a home that doesn't have water. And that's the group of people in the city of Detroit that we're trying to find and get to come in and help us help them. We need them to be willing participants, to be able to tell us what their situation is so that we can have our Community Action Agency, Wayne Metro, evaluate them and find other resources within the federal, state, county, city system to be able to address their issues. Now, turning the water back on while we're in this crisis is the immediate emergency. But that's not all we want to do. Once we get their water back on, we want to get into those homes and be able to fix the plumbing issues so that we can get them to an average bill. Then we give them some financial assistance and they have an affordable bill. So what do they need to do? Simply three things. First of all, call Wayne Metro. Make the appointment. As soon as you make the appointment, a work order will be generated and we will reconnect the service. Then make the appointment so that we can evaluate your situation and be able to find the additional dollars in the system to be able to have you have an affordable situation. Make the phone call, make the appointment, and you will keep your water on. With that said, I'd like to turn the podium over to Councilmember Roy McAllister.
And Director Brown, I want to thank you for developing this program. When me and my colleagues looked at the RAP program, we were very appreciative of some of the programs that the RAP program is bringing forward, because it is assisting people as far as, again, it's been stated, it's not necessarily about having the funding, but also having the affordability as well as the assistance to keep your programs on. And when we talk about only 6%, still that is too high. So the RAP program is also assisting that, and I want to thank the mayor for coming in and being involved in this program. And it's very, very well orchestrated, because we have the state, which is the governor, the city, which is the mayor, the county, which is the county exec, going behind Director Brown and assisting with this program. So many times when I'm out in the street, out and about, people come to me and talk about their water. Now I can direct them to where they can go to get that assistance. So not only is your water turned off, but if it is noted, then there is assistance programs to help it keep it on. So these are the things that I thank Director Brown for. I thank the mayor, I thank the governor, and I thank the county exec and everybody that's working together with this. And I also want to thank our Director of Health, Ms. Deborah Fair, Director Deborah Fair, who I'm going to turn over the mic to Denise Fair, Denise Fair, to help turn over the mic and let her speak her program. Thank you.
Close enough. Good afternoon, everyone. So my name is Denise Fair, and first I just want to thank Mayor Duggan, Governor Whitmer, and also Gary Brown from the Water Department. On behalf of the Detroit Department of Health, we just really applaud them, because this is the right thing to do. This is one of the best ways to minimize the spread of the COVID-19 virus. And the way that we can do this is by practicing good hand hygiene, and access to clean water is essential. Now, this plan ensures residents may continue to receive this vital resource and protect themselves and their loved ones. So again, I do want to applaud the Water Department, Mayor Duggan, and Governor Whitmer. Now I do want to switch gears and speak a little bit about COVID-19 and share with you what we know to date. Again, to date, there have been no cases of COVID-19 in Michigan, and the risk remains low for the general public. The Detroit Health Department, we are in constant communication with the state, with local health departments, with the CDC, because we need to make sure that we are preparing, because it's not a matter of if COVID-19 comes to Detroit, but it's a matter of when, and we need to be prepared. We are providing regular updates and resources to our businesses, to our educational, faith-based, and community leaders, to ensure communities are also well informed. Now, I do realize that media coverage can sometimes be a little bit scary, and we need to do the following things to protect ourselves and our loved ones. Number one is practice good hand hygiene, making sure that you're washing your hands for at least 20 seconds, or using alcohol-based sanitizer, at least 60 to 90% alcohol. Avoid touching your eyes, your nose, or your mouth in unwashed hands. Avoid close contact with people who are sick. Practicing social distancing, and when you are home, when you are sick, to stay home. Finally, covering your cough or sneeze with a tissue and washing your hands, and making sure that you are cleaning those high-touch objects or surfaces on a regular basis. So together we can help to slow this virus. And I'd like to again thank Mayor Duggan and Gary Brown for this initiative, which I know will benefit several of the Detroit residents. And I continue to look forward with our partners to ensure the safety of residents is addressing this important community health concern. So thanks again. And now I will turn it over to Gary Brown. Thank you.
Okay. Thank you. And I'd be remiss if I didn't acknowledge Plencia Mobley. She is the Deputy Director of DWSD, as well as the Chief Engineer, and really my partner in developing every plan that we put together here. And let me assure you that there's nothing that we do here. Every decision we make, we take into consideration our customers' ability to pay and how that's going to affect them. So with that said, we'd be glad to take any of your questions. Yeah, we're making this program available with a phone call. You get your phone, your water on with a phone call, and making the appointment. We were very cognizant of we didn't want people lined up in our customer service centers. We didn't want our phones jammed up. We wanted to make it as easy as possible. And when you leave, I encourage you, when you go out the door, to look at the customer service center, and you'll see when I checked at 11:30, there's not one person sitting in there, and we're sitting on yesterday $1.3 million. We've just been reallocated from the Great Lakes Water Authority another $1.1 million, and we're very hopeful in July we'll have an additional $5 million to help those that need it. So we have the dollars available. We have the challenge that every utility in America has, and that's getting customers to come in and ask for the assistance so we can evaluate them and get them the help they need.
Is there any outreach that you can do knowing that you have this number of 3,000 or so people?
Yeah, sure. Starting on Thursday, we're going to go to all 3,000 of the homes that we know. We're going to physically send a person to that home. We're going to knock on the door. We're going to personally try to give them the information. If they're not there, we will leave a door knocker that has the information, the phone number, and the route to get their service back on. So we're going to reach out to them. We're not just depending on them to call us. And that'll start on Thursday.
So the current estimate is there's about 3,000 people you expect to be that are shut off currently?
Well, we know that there are 3,000 people that were shut off in the year 2019 till today. We know that we've been out to those homes on prior occasions since the water was shut off, and that a great number of them are empty. Some of them have turned the water on themselves, so they have service. And then there's a number of those 3,000 that do not have service and have people living in there. And so we're going to reach out to all 3,000 once again to see if anyone new has moved in, there's no water, and try to get the water restored.
What about folks who are shut off eligible right now but not actually shut off?
Well, let me be clear as to who is eligible. Because we have, as the mayor indicated, 16,500 people that are being helped today by either the RAP program or what we call the 10-30-50 program. They're not eligible for this program. If you have water on today, you're not eligible for this program unless your water is off or you've received a notice through a door knocker on your home that your water is going to be shut off in the very near future. So it's the customers that don't have water and have a pending shut-off notice that they're going to be shut within the next 10 days. They're eligible for this program.
Let's be clear. There is some number of people who don't have water today. I do not believe that number is very high, but we're going to find out as we knock on the doors. But second, anybody who gets a bill in the mail that has a shut-off warning on it should immediately dial the number. If a door hanger is placed on your door, you should immediately dial this number, because we will, if you come in and get in the program, put you on the $25 program immediately, and the state will pay the first $25. So that's who this is targeting at. You open your bill and there's a shut-off notice. A shut-off notice is on your door. You can prevent it by simply calling the number, and this program will kick in, and there's no reason for you to discontinue your service.
Service was recently interrupted in non-payment. So
Right.
is the cutoff 2019 then?
No, if you do not have service today, call the number. The service will be restored. The governor will pay the first $25. If you don't have service, call the number. We believe that number of people is actually very small, but we're going to find out. And if we're wrong, we're wrong. But whatever number it is, we will turn them back on as soon as you make the phone call and set up the appointment.
Regardless of how long their water's been.
Exactly. There's nothing complicated about this. If your water's off, dial the number and the water will come on. If you got a shut-off notice in the mail recently, call the number and it won't be shut off. It's really that simple, and then it'll be $25 a month. One last point I'd like to make is Dave Masser, our Chief Financial Officer, was also instrumental in working this out with the governor's staff. He's sitting in the back not taking any credit, but thank you for what you did.
Can you answer a question? I apologize in advance, it may be convoluted, but we get the president talking about a hoax. We get other health officials and others online, albeit saying we don't have enough test kits. We really don't have our arms around numbers. I'm just curious from where you sit about the response to this. How concerned should people be? Should people not overreact? I mean, where are we with what's happening?
So my perspective on this was the last flu virus scare we had in this country was 2009, the H1N1, what was called swine flu. I was the CEO at the Detroit Medical Center. I was in the middle of the response to it, and this is something I understand very well. The reason we are here today is because there are no confirmed cases in Michigan. Doesn't mean somebody doesn't have the virus. The symptoms of COVID-19 and seasonal flu are very similar. Your doctor can't tell them apart. If you go in and you think you may have the coronavirus, they will ask you a lot of questions about your travel history. And if you've been to China or South Korea or Northern Italy, it will get flagged. The way they find out whether it's seasonal flu or the coronavirus is to take a swab, send the test to the lab, and the lab can detect the different flu strains. And if you have the coronavirus strain, you will be immediately quarantined. And so in the state of Michigan, I feel like we are in very good shape. We have test kits through the state. The doctors know what they're looking for, and we are prepared. The question becomes, once you identify somebody, then there is really intense detective work by the state and city health departments to go back to who were you with, where did it come from. Nearly all the cases in the United States today have tracked back in from people coming from China or Italy or another country, or were spread from people who came there. And so you're starting to see in China, they're doing a very effective job of getting it under control through very intense quarantine activities. We haven't hit that point yet in the United States, outside maybe suburban Seattle, but we may. And we know what we have to do. Everybody at the state and the city is ready for it. And I feel like we are prepared. And with this step today, this is the difference between being reactive and planning ahead. We are announcing this plan today before there's a single confirmed case in the state of Michigan. This is the way you should prepare, is have this in place. And so part of the reason we rushed to the day before the primary wasn't necessarily the best news day, but we felt this was so important that we wanted to get out there right away. So I feel like we're doing the right things. I feel like the governor and her team have provided great leadership on this. And you know, we're just going to keep going. I'm not going to debate what CDC and the national folks have done. I'll leave that to others.
Do you feel, though, that there is a not to panic message that needs to be said here as well,
Yeah.
or not?
And so here's the difference. You had 36,000 Americans die of seasonal flu last year. We've had 12 or 14 die of COVID-19. That's on a relative basis. The difference is this, that with the seasonal flu, nearly all of the deaths are from elderly individuals who have health problems, or in some cases children. Very rarely do you ever have a healthy adult die from seasonal flu. COVID-19, because it appears to have recently come from animals, we don't have the immunities in our body. And so you have seen healthy adults die of COVID-19, which is something that you don't see in the flu. It is a very small percentage, but it's something we don't normally see. And so taking these precautions, I think, are absolutely justified. And so I don't think there's been overreaction. I think we're right to be doing what we're doing. On the other hand, you should wash your hands and not cough or sneeze into the air every year with the seasonal flu. And I think to the extent COVID-19 is causing people to engage in better health habits, it's a good thing for everyone in the long run.
Do you know
Yes.
if any other water departments in any other major cities are doing a similar?
Gary?
I do not know if they have. I know that they don't have the RAP program that we have in the city of Detroit, but a lot of the other cities are calling and would like to implement the programs that we're putting in place. That's a great question. So we will have a database of people that have been shut off and are now back on. After the virus crisis is over with, we will decide whether that group of people are eligible for the RAP program, and we will enroll them in RAP. And if they're not eligible because their income is way too high, then we will put them in the 10/30/50 plan. So we have a plan for every single customer not to see a service interruption if they simply come in and ask for help.
So just to be clear, the $25 a month, if you're in this program, that is your bill, right? You're not being billed additionally that you'll have to
Yeah,
pay back.
that's the bill as long as this program's in place.
But when you say, but we are deferring, well, you, let's be clear on that. We are deferring part of that, but what will happen is, I don't know if it'll be 6 months, 12 months, 18 months. I have no idea the point at which a vaccine is developed, the COVID-19 antibodies are built up in all of us. Whatever point that is, those extra payments will be made part of a long-term payment plan. So when the $25 program ends, you will be put into another payment plan that you can afford so that nobody is shut off for a lack of ability to pay. And over the next 6 or 12 months, we'll work those details out. But we're not just going to drop people at the end of this. We will phase them into a plan that they can afford.
Okay, there are
Thank
no
you
other
all.
questions. We appreciate you coming. Thank you.